Next up, I'm really excited to introduce all the way from Qatar, from Weill Cornell. I'm really excited to introduce Dr. Fatimah and Dr. Amal Khidir. So Dr. Issa is the director of the Office of Clinical and Faculty Affairs and assistant professor of psychology, teaching and medicine at Weill Cornell Medical College, Qatar. And people development has been her passion throughout her entire career. And prior to living in Qatar, she lived in Japan, Indonesia, and the United States. And she worked at several global corporations, developing and implementing various programs with a holistic approach. And Dr. Khidir is an associate professor of pediatrics at Weill Cornell Medicine, Qatar. She's also the vice chair of IRB and pediatric clerkship director. She's a fellow of the American Academy of Pediatrics, the section on global health and the section on international medical graduates. And she's the co-leader of the Research and Scholarship Collaborative and the co-chair of the annual meeting committee for the Council of Medical Students Education in Pediatrics. Thank you so much to both of you for joining us today. They will be talking about building professional identity among students. Over to you.
Thank you, Mayor. Can you all hear me?
Yes.
Okay. Do I have a okay, I need to. Can I have a control of the PowerPoint, please? Or should I?
I'm not sure how to do that because I don't have, okay. I'm not the one sharing it.
You have it, go ahead.
Okay,
yeah.
All right. So I'm going to talk about professional identity formation today, which is a big topic, isn't it? So let me start with my little story, which might give you some ideas. Once upon a time, before I entered my career in medical education, I was leading a talent development for global corporations. That was when the war of talent started to emerge. So we screened, assessed, and recruited so many future leaders, including corporate physicians and nurses. Telling you the truth, academic achievement were just one of the success factors among many others, such as well-roundedness. We were convinced that leadership experience or any levels of involvement in different types of activities equip young people with good social intelligence, emotional intelligence, and many other valuable competencies. So now coming back to you, your story now, who aspire to become physicians or to pursue other careers in healthcare, at one point, you need to answer these questions. So what do you want to be in your dream career? What is the best career identity that you can imagine? I know this is not an easy question, and professional identity formation is truly a long journey. So what's important now is for yourself to getting to know yourself better. How much do you know about yourself? My question to all of you. What are your dominant personality traits? Do you consider yourself towards an introvert person, extrovert person, a feeling person, a logic person? What is your most important value? Is it integrity, honesty, perfection? And last but not least, ask yourself what is unique and special about you. Okay, now look at this slide. The way how you perceive what's happening around you is very much influenced by your values, beliefs, personality, language, decision rules, and so on. So for example, if your value is perfection, if something happened, for example, getting a bad grade you fail in the mock exam, that would lead to a thinking like, oh, I am so bad, I am not good, I am not good enough. And then this would lead to demotivation. You will not do something else or some other strategy to improve your outcome. So really, I mean, what you have thinking, your thought, your behavior is not telling who you are. How much do you know about yourself? You are more bigger than what you are thinking and what you do. Oops, sorry. Okay, so when you know who you are, then you will know what you have to develop or what you can change so that you can come closer to the best career identity. And another thing I like to mention here is that we all play different roles in our lives. So ask yourself, how many hats do you wear? A hat as a child to your parents. It can be as a student. Are you a friend? And what about the identity in each role? Are those identities in harmony? Are you happy? Or do you want to change? Remember that the power of change is within you. If you remember the previous slide, you can change your value. You can change even personality and beliefs. So you can change. So this is going back to my little story at the beginning. In addition to learning about yourself, remember that to become successful physicians or leaders in whatever the field that you would choose, you have to be active in the outside world in different activities so that you can learn how to interact and collaborate with others. You can start with small activities, maybe small organization or clubs that related to your interests or your hobby. Small steps matters because each experience will form your attitudes, mindset, and different type of intelligence that help you succeed when you enter the professional careers. So this is just food for thought for you today. And my colleague, Dr. Amal, will tell you more about professionalism, specifically in healthcare. So please, Dr. Amal.
Thank you very much, Fatma, for getting us started. And I'm going to go over what happened. Okay. The screen disappeared, right?
I can see it now.
You can see them? Okay.
Yes.
Okay, fair enough. Thank you. Thank you very much, Dr. Isa, for getting us started. And I do have no conflict interest on what I'm going to talk to you about. We're going to start talking about some definitions related to professionalism. And one of them is by Arnold Stern in 2006. Basically, it is the characteristics and the skills that you gain. As you know, you start with the knowledge itself, with your clinical competency. Then you gather some more communication skills. It can be verbal and nonverbal. And in some contexts, the nonverbal is more strong and really effective and affect people around you. Then you get to learn some ethical and legal understanding. And all of these are also bundled around excellence. It can be excellence in patient care, humanism, accountability, and altruism. And these pillars are only these four, but there are a few more. You know, there is respect, honesty, and accountability, and others. And all of these lead to professionalism. So this is one of the definitions. The other thing is we're all in the medical field roughly, and some of them of our attendees are students who are inspired to join the healthcare. Their professionalism is guided by some principles, and this is from the American Board of Internal Medicine, which they call it the Physician Charter. The main principles are the patient welfare, patient autonomy, and social justice. And they came up with some responsibilities. As you see, it's very important to have the professional competence and responsibilities in hand. Basically, honesty, and not honesty with patients only, across the board, even in your documentation and communication with your colleagues. Patient confidentiality is very critical. Maintaining appropriate relationships with your patients, and also definitely we have to have also appropriate relationship with the industry itself and the pharmaceutical companies. Basically, you look down there, maintaining trust by managing your conflicts. Also just distribution of finance resources. And this is very important since we're talking about global health, because as you know, in some contexts, things can take different directions. Improving quality and access of care to all your patients. And also the scientific knowledge is very critical. So this is what is mentioned in the Physician Charter. So if you come to reality, following up to what Dr. Isa just mentioned, if you think about it, this is you. If you are a student, if you're a resident, if you're a physician or health provider, you are surrounded by your colleagues, and colleagues can be the people with you in the same field or at the same level, or it can be the staff. If you're talking about a hospital, it can be the whole staff from the receptionist to the nurses, pharmacy, others. And then you are within a certain specific institution. It can be a hospital, it can be your medical school, it can be your undergrad school. And then you're surrounded by the society. And what's happening, all of these are interacting and affecting each other, and affects you too. The other way you can look at it, as a learner, you are within a college of medicine, or you are within a residency training or any other institution where it's your medical profession or the place where you work. But then we are not only interacting there. There is another group interacting, which is within the society. You have the governance and the managers interacting against with each other. You have the learners also interacting with public. And there is a lot of dynamic processes happening there. And between both of them, they're not in silo. There is a lot of obligation and expectations, and they are always interacting and interchanging some skills and interactions. And that also is bundled within professionalism. So I wanted to highlight from these last two slides is, no matter what we think and what we do, we have to also respond to what we have around us, because we influence them and they influence us too. So this is a nice article, and I'm going to share with you the name of it down there by the Cruises. And it has more than one, and because of the tight time, I just shared one schematic representation of the professional identity formation and socialization. So if you think about the following to what Dr. Isa just talked about, basically, if you think about professional identity formation, are the characteristics and descriptions of a person that distinguish the person from others. So all of us come to any workplace or educational institute or others. We come with our genetic predisposition. We come with our understanding of sex and race. We have our personal expertise and experiences and characteristics. We're also affected by the culture and the religion. We come to the class and interact with other, okay? And then when we enter to that institution or to that workplace or educational site, we socialize. We bring with us our morals and values, as I mentioned, and you come interact with others. And with others, and the workplace or the institute has its own values and its own culture. And one of three things will happen. Either there's match your values, so you accept it and you really do well, no issues, or it might be against your values, and then there where the friction happens and rejection happen, and then the problems creeps up. Or it might be different, but you're willing to negotiate or maybe to compromise. So one of the three might happen there. And then by the end of that journey, you will end up changed somehow, okay? And that will affect you, and that's how the growth happen. And actually, it is found out even for the high schooler or medical students, their professional identity actually matures more, and the real time to happen, all of that is during residency. And all this process is preparing you for that. And if you think about it, usually people are in the periphery, they join a community of practice and they get modified, affected, and by the context and by the people, by the learning environment, by your role model and others. And there where the social interaction happen, and by that you end up in full participation. So this is just a quick schematic explaining it, but there are two more in this wonderful article. I really encourage you to have a look at it. Saying that, it sounds straightforward, right? There's another piece, since we're talking about global health and we're talking about innovation, we have the cultural complexity. And I think Fatimah and I, or Dr. Ace and I, are blessed to be in a very complex context over here where we have more than 175 languages and different cultures, people from different sides of the world. So there are a few things that comes in that you visibly see. For example, henna, it's not a tattoo, it's reversible. It's very important for certain tribes and communities. It's people wear it in weddings and engagements and others. There is also the scarification for women or men, and this can go back to tribes. It can go back to where they belong to. And also we do have tattoos. And these are all visible. But there is a lot that we might not pick until we look into or be mindful of or ask or try to understand. And the other piece is saying what I said. I will go over quick definitions that you can get it in the dictionary and others. For example, what do we mean by culture? The culture are basically group of customs, arts, social interactions, and achievement of a particular group or nation or a social group. Example, it can be the dress, it can be the architecture, it can be what they eat, their lifestyle, their beliefs, their religion, and holidays and others. And what is socialization? Basically, socialization is the activity of mixing socially with others, the process of learning how to behave in a way that is acceptable by the society. And in Prue's document or article, he mentioned socialization is the process that how people learn how to function by interacting and also internalizing the values they learn. The other piece here I want to add is enculturation. And this is important for all of us because we move from one, let's say, workplace to the other because of jobs or residency, or you left your family and home and you came for medical school, or you're going somewhere else. So there is a process called enculturation, and by definition is the gradual acquisition of the characteristics and norms of a culture or group by a person or by another culture. So we all do go through this process when we change places or we join another group. And this related to the healthcare, why do we care? Because the culture and socialization are the processes that inform our personal, professional identity. It also influences our perceptions and expectations of others. And this can be us with colleagues, us with staff, us with the society, and us with the patients too. And also differentiate us from other professions. With that, I end my talk and we are available for any questions.
Thank you so much, Dr. Issa and Dr. Khidir, for this very amazing and inspiring presentation. This is such a pertinent topic, and I think a lot of, especially for the medical students we have here, and even for the high school students who are looking to go into a medical profession. So this is often overlooked, it's so important.